What do you think about? I agree. I agree with you about the car insurance being too damn high. But and that was a big issue between Whitmer and Abdul Al Sayed.
Health insurance makes car insurance cheaper.
Right.
You know, yes.
And our health, we did have legislation addressing it. So. Yeah. Now, like for the first time, and I thought Whitmer was probably in car insurance pocket. I thought they probably were not going she wasn't going to do anything about that after hearing the debates between her and Abdul Al Sayed, but she did. And also the only ideas on healthcare really seemed like they're on the Democratic side, whether you like Obamacare or whether you like Obamacare or Medicare for all, repeal and replace doesn't have a replace. So would speak a little bit on healthcare and what you think about it, I guess.
Yeah, I was wondering, like, say, I totally understand the strategy of running single issue in order to move the conversation for the two major parties. But say you do win, what healthcare plan are you advocating for?
It's a big rewind as far as just the libertarian platform is concerned, because ever since Obama took office and made health care a big issue, we've never said the words health care and meant health care. We've been talking about health insurance this entire time. And if you're stuck in the idea that you need health insurance to pay for your health care, then yeah, of course the system that we had before Obamacare was garbage and needed to be fixed and replaced. And then if you make Obamacare, which is all about health insurance, of course it's not going to really solve anything either. And now the replacement for that on the Democratic side is just free health insurance. It's not really free health care, it's free health insurance.
True. Yeah.
Totally. But what's the alternative?
Erase from your mind that this is something that insurance pays for. Start thinking of insurance as, Chris Rock called it, in case shit happens. But there's maintenance. There's a cost to being alive, just like there's a cost to owning a car. But we don't use our car insurance to pay for our oil changes or to get a fill-up.
So you think the greater issue is that we need to lower the cost of healthcare, and
you have to lower the cost of healthcare so that you can buy it without insurance, and you can afford insurance that just covers when you get hit by a bus, when a tumor shows up, something like that, and that insurance will be much more affordable. And then even people who can't afford that will be able to get it through, the goodwill of others. And the maintenance costs of being alive, being a human being with a body that you're in that needs to be taken care of will also be cheaper as well. It's just a prime example of anybody who used to take something like Allegra. I used to get a prescription for Allegra, and my prescription Allegra was $60 a bottle, but then it stopped being a prescription drug. It became an over-the-counter drug. Over-the-counter drugs aren't covered by health insurance. Magically, it's $11 now, $5 if you get the 4 brand. But it's having something that's covered by insurance that you don't just go shopping for that makes it expensive in the first place. So everybody's imagining this world where the actual care that you get stays the same price, and you're like, you want me to pay that? Like, no, I want the price for everything to go way down, and then you're going to start to realize you don't need as big of an insurance coverage that you have right now. You don't need the government to get it for you, or if you do, you really don't want it. It's like we have food stamps, but you'd rather go buy your own food.
Mike, I had one follow-up question for you. Do you think that there should be do you think that the price to keep yourself alive in this instance with healthcare, for instance, should be as high as it is? Or do you think that there should be stuff that's free at point of service where you show up and like you have a catastrophe or something, you don't they've got to treat you anyway. Like, don't you think that we should work out some sort of system? What's the libertarian system for that?
Yeah, I'm going to go off, platform, don't want to speak for all libertarians, but I thought about certain things where, I accept the fact that, if your house catches fire, the fireman's going to come. So there are probably some medical equivalents to that. But yeah,
they have to treat you. They have to treat you at this point. If you go to the emergency room and you don't have anything, they still have to treat you. But that wasn't always the case. Have you thought in your head, a system, there are certain libertarians that are against the fire department, that obviously you're not. Yeah. But obviously you're not. Did you think that there's a system by which, have you thought about a healthcare system? I want to, what's your healthcare system besides bringing costs down? I agree with bringing costs down.
Costs down through market forces. So you really just take away, and then some of this, the government can't legislate a lot of this. Some of it just has to be the way we as consumers change the way we consume this product. And some of that is, wrapped up in Medicare, Medicaid. There are doctors that if they want to accept Medicare, Medicaid, they have to follow their pricing guidelines. And it's actually doctors who stop accepting Medicare, Medicaid who end up lowering their prices because they no longer are bound to what dictated price is. So it's different options like that. There are some practicing doctors who have already made examples, and with a bit of deregulation, it can get better, it gets easier. And when you're talking about what do I think needs to happen to put everything into the libertarian mindset, everything that I do think about is, do I think this is so important that I need somebody with a gun to come put somebody else in a cage if they don't participate in this arrangement? Because that is the end all be all of everything that the government provides or enforces. So yeah, should the government do some things here or there, but it has to be something that's so important that I think a man with a gun should come to your house and put you in a cage if you don't want to participate in it. Because that's
and people's health and people's health. I'm sorry, people's health is not like a basic health care for citizens.
No, we have an example of hundreds of millions of Americans who take care of their own on their own. Okay. I think we'd be a better society if we helped the people who couldn't do it on their own. And maybe there's a level where maybe you should get thrown in jail. I don't know. I don't think there's a whole heck of a lot that I want to throw people in jail for not participating in.
Okay. Andrew, a lot of what I think he's talking about is stuff that I think Trump promised. Essentially, he said it would be there'd be healthcare, it'd be much cheaper, it's going to be much better. But then what ended up happening was essentially he just lost the individual mandate for Obamacare, which I was the worst part of Obamacare, yes, but also isn't this just tiptoeing closer to either what we had before Obamacare, which wasn't that great, and then or like Medicare for all? Like what's the replace and is repeal and replace?
First of all, I want to say I was nodding my head at everything Mike was saying about pretty much everything he's said so far for the most part on this. I don't know if Joe Jorgensen is the best candidate for the ideology of libertarianism, but in terms of being a libertarian, that's pretty much where I fall ideologically. In terms of that, I will say my stance on Trump and healthcare is he faced obstructionism from both parties. I don't think, honestly, the Republican Party likes him that much either in terms of House and Senate. Other Republicans, in terms of in-party support among the electorate, he has a lot of support. But in terms of, I just think he wasn't able to get a lot done because first half of his term he was a lame duck with his party controlling both chambers of Congress. And he was a lame duck.
What did he want to get done? What did he want to get done? Like this is what I'm saying. Like it's cool. It's cool to say like we're there. Everyone's against us, and like this system is bad, that system is bad. What is the system that we're going to have under Republicans or Libertarians, for that matter, for healthcare to get basic?
I think a lot less regulation of the healthcare industry. I think a lot less paperwork, a lot less rules and regulation, a lot less red tape preventing people. If you want to be able to get an experimental treatment, you should be permitted to. That sort of thing. Free up the market. I think we need less government intervention.
And you don't accept I think you're of the same mind as Mike, where you don't see healthcare or health coverage as a necessary thing for our society or a human right.
I definitely do not think that. It should be a right. I think it should be, just like food. We all need food, but you got to buy food. And I mean, I don't think food stamps is the worst government program, but I definitely am opposed ideologically to it. Just like with healthcare, I think it's a commodity. It's an individual commodity. Your health is a commodity that should be paid for individually, or at least not through government.
Throwing it back to Anthony, I mean, and this kind of gets into the party politics in general, loyalty and efficacy. The Democratic Party does tout itself as the healthcare party, or like the party that you can keep voting on in if you want to get through the light at the end of the tunnel, as you see. But before Bernie Sanders and Elizabeth Warren, and I know you're a Warren supporter, they didn't prioritize it very much, did they?
Once you started getting insurance, and I do agree with Mike with we're talking about insurance, but not healthcare. But the insurance also it can't mandate, can't make you. But most of the insurance policies from Obamacare, you were required to have your oil changes, which do things like have your yearly checkups, or and your flu shots and things like that to catch things before. I had private insurance when I worked for it, which is one of the reasons that I worked for a corporation. So when I went through my cancer junk, paying out of my paycheck for private insurance and all of that, my part of that was over $50,000 still, with supposedly super insurance, super company, over 50 grand. And I'm still paying that. Like it's ridiculous. So did all of that, not with the company anymore. They actually got rid of me because they had the cancer, like, whoa, to not have to pay their part of the insurance. Got Obamacare, much less, and they paid for everything, the treatment, the radiation and stuff that I had to have after. And it was pretty much free to me. So the healthcare is a commodity. What do you have the government for? And I mean, you need government for just not complete whatever, but what do you have politicians for? Be they Democrat, Republican, Libertarian, whatever. What are you paying those guys for? What do you want to do with your tax money? And you will be taxed whoever. I mean, it's ridiculous for people to think that society would work without the services that we have, and that people would be able to pay for those services.